my daughter.
Getting the COVID-19 vaccine for me will be a huge priority. I want to do everything that I can to keep my staff healthy. It's really just the only option to resume normal life.
Walking through to the chair where the vaccine felt like a hero walk. And I feel that everyone who is going to receive the vaccine is gonna get that feeling. You know, that split-second jab represented so much hope.
I have my sticker that says I did get my vaccination. I deal with COVID face-to-face every day, and I want to protect myself, protect my coworkers, and protect the patients that I do see.
We all get vaccinated, we'd be better off. Not only important, I think it's essential that people do it. We're all in this together. Once you realize that, it found it a lot easier.
It's been really difficult lately. It's hard to teach with a mask on and not being able to project your voice. It's hard to not see the kids' expressions on their faces.
I want this needle to help me to live for a while more so I can enjoy my grandchildren and go big berries and go have fun.
I miss coming to the game. When it's time for me to get the shot, I'm gonna go sit down in the chair and close my eyes and tell them to stick me.
It's going to save not only my life, it's going to save lives of the people around me, the babies that I care for, my grandchildren, my parents. It will be so nice to not live with that fear.
I think I want to get back to being a 27-year-old, right? Back to having something to look forward to, the regular stuff.
The job is very rewarding.
Thank you for joining us today, everyone. In the Legislative Building in Regina, we have Premier Scott Moe. Joining us by video conference is Dr. Shahab. As well, from the SHA, we have SHA CEO Scott Livingstone and Derek Miller. Premier will have some opening comments, and I believe there's also a brief presentation from the SHA regarding the first dose strategy. Premier?
Maybe just before I begin here today, in light of the procession that we saw in Wolseley today in honor of Constable Shelby Patton, I would just offer on behalf of the province our condolences to the late Constable Shelby Patton's wife, his family, and all of his friends, and really express our deep gratitude for the service that this young man had provided on behalf of his community and on behalf of the province and the nation of Canada. Good afternoon, everyone. Thank you for joining us for this COVID update here this afternoon. In the province, things continue to move in the right direction. Today, we are reporting the lowest number of new cases in a day, and we also have the lowest 7-day average since early November of last year. This is a very strong positive of the direction we're headed. With thousands of people that are getting vaccinated each and every day, our numbers do continue to fall. And we can keep moving forward with our reopening roadmap as we had planned. This Sunday, we will move to step 2 of that reopening. In step 2, capacity limits on retail and personal services, table capacity limits in restaurants will be removed. Event facilities such as theaters, casinos, museums, and recreational facilities will be able to increase their capacity to 150 people. And private indoor gatherings, included in that are household gatherings, they can now increase to 15 people. While public indoor gatherings and private outdoor gatherings will be able to increase to 150 people. Significant increase over where we have been. We are now very close to also reaching the benchmark for step 3, our step 3 reopening threshold. We're actually less than 1% away from that threshold. Just need 1% more of Saskatchewan people to reach out and get their first shot for us to reach that target. If that happens by the Sunday, of course, then step 3 would start on July the 11th. And when step 3 starts, most COVID restrictions are then removed. And when 70% of all eligible residents over the age of 12 receive their first shot, then we will be able to set the date for all the remaining public health orders to also be removed. This includes removing the mandatory mask order and all of the limits on gathering sizes. So once again, I would just once again encourage everyone in Saskatchewan who has not went out and got their first shot to this point to now is the time. Now is the time. Vaccines have never been more plentiful, never been more accessible in your community or close to you. Don't put it off any longer. Let's go today. Let's go this week, and let's get our first shot. It's a question that's been asked a number of times in recent days. Is Saskatchewan going to have some type of lottery or giveaway to try to entice more people to get vaccinated? And the fact is this. In this part of the world, you're already winning by just getting vaccinated and having the opportunity to get vaccinated. In this province, 92% of our new COVID cases are people that have, for some reason or another, are not vaccinated at this point in time, and there's multiple reasons why that might be. 82% of our hospitalizations are people that are not vaccinated. So here's what you win. You get to protect yourself from COVID, and those numbers show that vaccines do work, and they work very well. You get to protect your family, your friends, your loved ones, and everyone around you from this COVID virus. If you like to gamble, then I would suggest you don't get your shot. The prize is not what you think it is. So you and your community, I guess another win would be is if enough of us get our first dose and ultimately our second dose. In addition to keeping yourself safe, your loved ones, your family members safe, you and your community, and ultimately your province will be able to move forward with safely reopening and continuing to remove all of the restrictions that we have had in place for over a year now. So health, peace of mind, a safer province, safer communities, and the return to things as we once knew them, those are pretty great prizes in my mind. And all we need to do is go out and each of us and get vaccinated. And when everyone does, we get to win all of those prizes. We've already had nearly 700,000 very lucky winners in this province who went out and got their first shot. We did that without having a lottery, and we still have plenty of more vaccines left for anyone else that would make that choice. So are we going to have a lottery on top of all of these successes of getting a vaccine? No, we're not. It's just the right thing to do, and we'd ask you to do it. This week, we are making additional efforts to make getting vaccinated as convenient as possible, in particular for those that have not yet had their first shot for some reason or another. And as I said, there's many reasons why that might be. We've set up a number of first dose clinics in places that people work, places that people play, and places where people live. This is in addition to the school vaccination clinics that are operating and are taking place in multiple schools and multiple communities across the province. There's going to be vaccination clinics in places such as work sites, sports venues, community centers, and many other locations in many communities. And the SHA is going to provide some additional detail about these locations as time goes by this week. Once you receive your first shot, it's important to go back and get your second shot so you are fully protected. Your job is not finished at the first dose. Some of the emerging variants, particularly the Delta variant, are still being contracted by many people that have only received their one dose. But transmission is very low among people who are fully vaccinated. And that's why we are moving ahead as quickly as possible, not only with our first shot access, but providing second shots to as many residents in Saskatchewan as we possibly can. Yesterday, we lowered the age for the second shot eligibility to everyone 50 years and older. And already, 45% of Saskatchewan residents over the age of 50 have received their second shot, and they would be now, after 2 weeks, considered fully vaccinated. In fact, 21% of everyone over the age of 12 has now received their second shot. This is a very strong number across Canada. In fact, it's the highest number of any province in the nation. On Thursday, the age is going to drop again to 45, and by next week, everyone in Saskatchewan age 12 and older will be able to receive their second shot. So long as they've had enough time pass from the time that they had their first shot. So as you can see, as we've gotten into this vaccination program, the time between shots has narrowed considerably. Here's another benefit of being fully vaccinated. Over the past 15 months, many of us, myself included, have had to self-isolate for a period of time because we were in contact with someone with COVID. And I was fortunate. I was able to work from home for the 10 days that I was required to self-isolate. Some people don't have that option. My wife, for example, didn't have that option. So being required to self-isolate, and I understand, has been a tremendous hardship for many in this province. Once you're fully vaccinated, if you are identified as a close contact of someone who has COVID, you will no longer be required to self-isolate. If you are not fully vaccinated, you will be required to self-isolate. So that is a pretty significant benefit of getting vaccinated. As Saskatchewan moves forward with removing all of the provincial COVID restrictions, and we plan to, there's still one important area that's under the control of the federal government, and that's cross-border travel or international travel. And we believe that once you are fully vaccinated, you should be free to travel, return to Canada, and not be required to quarantine for a period of time. And so today I wrote our Intergovernmental Affairs Minister, Dominic LeBlanc, and I'd asked him and asked the federal government to immediately develop a plan for cross-border travel so that Canadians will know what the plan is in the weeks ahead. Offering any assistance from Saskatchewan in developing any documentation to allow a fully Canadian residents that live in this province to allow those fully vaccinated travelers to return to Canada without quarantine requirements. And we will work closely with the federal government for that, as we have committed previously. I think this is one more important personal freedom that can be restored in short order to those Canadians that have made the decision to go out and get not one shot, but to get 2 shots. And I'd hope to see the federal government move on this important matter soon and communicate it to Canadians. Once again, I want to thank everyone who is giving the vaccinations, and I want to thank everyone who is receiving the vaccinations in this province. It's exactly 6 months ago today, on December the 15th, that the first shot went into an arm of a Saskatchewan resident. We all watched that on the evening news. It took nearly 3 months to get to 100,000 shots in this province, but today over 900,000 have been administered in the province. That's more than 800,000 shots in the last 3 months. By comparison. This has been a monumental effort involving thousands of healthcare workers, both in the SHA and outside, as well as many, many support staff across the province. And what we are doing as a province is truly making a difference. Every shot in the arm makes our communities and our province a much safer place, and it brings us much closer to bringing everything back to the way that it used to be and the way that it should be and the way that it will be in our province. So let's just keep this going right through to the finish line. Go get your first shot today or this week. If it's your turn, go back and get your second shot. Let's stick it to COVID. Let's get everything reopened like we want to, and let's have a great Saskatchewan summer. Dr. Shahab, do you have some comments? Okay.
None from me today, Premier. Thank you.
I have some, Premier.
Yeah. Sorry, yeah, go ahead, Scott.
Sure. So before I begin, I'd like to offer my condolences to the family and friends of our CMP Constable Shelby Patton. Our thoughts at the SHA are also with every member of the larger RCMP family. We know this weighs heavy on them, and we are thankful for their service in light of the risks they take each and every day. Today, we're going to mark another pivot in our immunization campaign. To date, our teams have successfully delivered more than 900,000 vaccines across the province. We've had an amazing response from both our healthcare teams surging to provide immunizations and the public who are stepping up to take them. Through our book clinics, pharmacies, hundreds of pop-up and mobile clinics across Saskatchewan, we've made significant efforts to reach people where they are. But like every strategy, it needs to be adjusted and tweaked as more evidence and data and feedback come in. That's why Derek is going to give a presentation in a minute outlining some of the new strategies that we are deploying to reach those who may be hesitant to get the vaccine. But before I hand it off to him, I want to emphasize that our goal has always been to make the shot as convenient as possible and deliver it as quickly as possible so that we can all get back to normal. Dr. Shahab presented last week that unvaccinated people are far more likely to get sick and far greater risk of dying from the COVID virus. So please, if you're still hesitant, talk to your doctor, talk to your pharmacist, call 811, get advice and get your vaccine. It could save your life. I'll now pass it off to Derek to go over the adaptations to the immunization strategy moving forward. Thank you. Go ahead, Derek.
Thank you, Scott. Today, I'm happy to provide an update on our first dose surge strategy. We'll cover off some of the things that we've been doing so far to drive uptake, talk about the targets for first dose uptake, as well as some of the new strategies that we'll be introducing over the coming week, and then finishing off with why it's critical to get your vaccine. To date, we've been operating with 4 key strategies in order to promote uptake of the vaccine. The first one is enhancing access. We've worked hard to bring the vaccine to the vulnerable and hard-to-reach populations through hundreds of mobile and pop-up clinics and outreach clinics that have happened in core neighborhoods and urban centers, but also other areas across the province. We also have a delivery model that provides convenience in multiple outlets like drive-thrus, booked appointments, pharmacies, as well as First Nations clinics. And then partnering most recently with the education sector to bring the vaccine in school, working with other organizations like First Nations, large workplaces, community-based organizations, and others in order to really bring the vaccine to those hard-to-reach populations. Secondly, we have worked to create champions in communities, such as clinical experts, community leaders, as well as everyday people in order to really become a voice for the vaccine and why it's important to get it. We've communicated the benefits of the vaccine broadly in broad marketing campaigns, emphasizing the safety and efficacy of the vaccine and how it's going to play a critical role in helping us get back to normal. And then lastly, modeling our values as healthcare workers, we are working to ensure that we have a high uptake as well in order to keep our staff safe and also send a message to the public about practicing what we preach. So let's look at the targets for the first dose. The Premier identified how close we are to achieving the step 3 target for 70% of those 18 years and older. We're looking at the next target to achieve full opening, which is looking at the 12-year-old and older group to have received a first dose and getting that up to 70%, currently sitting at 67%. And so this is our target over this coming week, is to really drive that number up and help Saskatchewan cross the line to achieve step 3 opening target. But we're not stopping there. As we progress through the summer, we want to continue to push the uptake past 70%, up to 80 and beyond, and for first doses as well as second doses. And this is so critical for us to ensure that every Saskatchewan resident is safe, families are safe, we have safe communities, and we mitigate the risk of any potential variants on the province going forward. So our strategy as we shift and really promote first dose, we are focusing on 3 key factors. The first is confidence. We believe that the confidence in the vaccine, in safety and efficacy is high. And so therefore we're going to focus primarily on complacency and convenience. And you would have heard Dr. Shahab talk about these 3 factors as part of any immunization campaign and how important they are. So by focusing on complacency and convenience, we are going to really focus also on the younger age groups, which we know have a lower uptake than older populations. Some of the things that we're going to be introducing this week includes increasing in convenience by bringing the vaccine to where Saskatchewan residents live, work, and play. The table here has a number of examples of the things we're going to be doing. First, in the area of where we live, we are going to expand school clinics to include opportunities for family members that haven't received their first dose to come in and get those where the schools are able to accommodate that traffic. We are creating dedicated first dose booked appointments to improve access and timeliness, creating fast pass lanes for first doses through our drive-thrus, as well as in many walk-in opportunities. We will be creating downtown pop-up clinics in malls and pedestrian areas in our urban centers. Also bringing the vaccine through various means to core neighborhood areas, and also targeting big box grocery store clinics. Beyond that, we will be taking the vaccine to where people work by partnering with large employers we're going to bring the vaccine to various organizations in order to offer first dose where people are working. And then lastly, where people play, you'll see pop-ups begin to appear on various sports fields across the province, targeting flag football leagues, ball games, and other recreational activities. We'll also be bringing the vaccine to the lake, water parks, and other rec areas where people like to spend their time in the summer in Saskatchewan. And then lastly, working with strong partner organizations like the Saskatchewan Rough Riders in order to promote the vaccine. This isn't an exhaustive list, but does provide many examples of the types of things that we'll be doing, and you'll see more communications coming out describing the when and the where of increasing our efforts to increase convenience. The other area of focus is on decreasing complacency. One of the primary things is to increase our communications about the health risks of going unvaccinated, particularly targeting towards the younger age groups. We know, and the Premier mentioned, as well as Scott and Dr. Shahab has talked about it, this is the group that we're going to see as positive cases in the future that are going to be in our hospitals. It's going to be those that are unvaccinated. We want to ensure a seamless experience for everyone getting their first doses by creating the first dose dedicated clinics, fast pass lanes, and other ways to make it as easy as possible for people to get their first dose. We're going to bring the vaccine to locations where the younger populations that we are targeting access anyways, and also creating partnerships with trusted organizations in order to really lower the barriers that are in place and help us celebrate vaccines and show how they can save lives and get us back to normal. Why is it critical to get the vaccine? So again, we know unvaccinated people are exponentially more likely to get sick, require hospitalization, and die. And that has proven itself in the evidence. Also, Saskatchewan people need relief from the ongoing restrictions on their lives, their livelihoods, and their freedoms. And lastly, Saskatchewan residents deserve a summer free from the fear of COVID. So if you haven't done so already, please come out and get your first or your second shot of a vaccine and help us stick it to COVID.
Thank you, Premier. Thank you, Scott and Derek. And for media looking to view the PowerPoint that Derek Miller just presented, it's linked at the bottom of the release on saskatchewan.ca, along with a detailed list of those first dose clinics that Derek Miller mentioned. I will now take questions, starting with questions from the room. Arthur?
Yes, you talked about the fact that the fact that the Delta variant is particularly well managed when you have 2 doses, but not necessarily when you have 1. And here we have a renewed focus on a first dose strategy, even as that particular variant seems to be getting more of a foothold in the province. We also saw Boris Johnson put a pause into his reopening plan because of the problems that they're having in that country because of the Delta variant. So why are we focusing so much on first doses and a first dose based reopening strategy when this particular variant seems to require 2 doses?
We're focusing, and Dr. Shahab, you might have a little more to add to this, or Scott or Derek as well. But I would say that we're not focusing solely on a first dose strategy. What we are doing is doing, I think Scott had said it at the outset, that we are trying to make vaccines conveniently available to as many people as possible so that we can get as many vaccines administered as quickly as we possibly can. And so that's including both the first dose and the second dose strategy. And I think it's either us or us in Alberta that are leading the nation in the numbers of second doses that we've administered. And yes, do we want to continue to push our first dose percentage up as we not only go into achieve the June the 20th benchmarks, but go beyond that. And I think the chart that Derek had put forward, where we are 67% now 12 and over, 70% is the target for June the 20th. But the target actually by the end of the summer is to continue on and ultimately hopefully get to 80% of everyone that is eligible to receive not just the first dose, but both the doses. And we're seeing that happen in the the 40+ age group. Our first benchmark is very, very close to that 80th percentile now. I think about 79%. And as Dr. Shahab has often said, once you're eligible for your first shot or second shot, you're always eligible. It doesn't go away. And so we would encourage people in the province that have not stepped forward or haven't had time or just haven't been able to make it work to attend a clinic for their first vaccination. We're trying to give that effort right now so that to address the convenience and maybe the complacency that some residents might have with the what we talk about, the urgency to go out and get that first initial dose, which is proving to be quite effective at many of the variants, if not virtually all of the variants. Not totally effective, but much more effective than if you had 0 doses. But at the same time that we're doing that and having this push or this effort to enhance access for those first doses, we're still very focused on the second doses. When you put a fast pass lane in a drive-through for someone that's coming in for a first dose to enhance that convenience, so they may not have to wait for an hour or 2 or 3 in the drive-through, so that they can go through and get their first dose. All of those second doses are still occurring, throughout the course of that day. And I think we're about 10,000 vaccines again administered yesterday, which is down a little bit from the days previous. I think that's still a weekend day that we're reporting out on. We would hope that will increase as we get into reporting this week's numbers. So I would say there's some renewed focus on increasing the convenience for the first dose administration and just making it more available for some of those that maybe haven't had the opportunity to receive their first dose. But in no way is this taking away from the effort and the initiatives that we have on continuing with our second dose strategy. We have for some period of time, we didn't have enough vaccines. We do have enough vaccines now. We have the capacity to deliver close to 20,000 vaccines a day. We've shown that on a number of days, and we want everyone in the province to consider not only getting their first dose but their second dose. Dr. Shahab, do you want to, because of the importance of the variants of concern, as well as just the importance of completing the vaccination schedule, of which I'd turn it over to my friend Dr. Shahab to speak in a little more depth about.
Yeah, thanks, Premier. So thanks, Arthur, for the question. And, obviously we have on a website and we're monitoring very closely the fact that, while Alpha, which was B117 first identified in the UK, is now the predominant strain. Beta, first identified in South Africa, 1351, has not taken off, and that's due to the excellent case contact investigations and by public health. Gamma P1, we've seen a gradual increase, mostly in the northwest parts of the province, primarily influenced by Alberta. But again, it's climbing steadily, and we've been concerned with north, central, northwest, lower vaccination rates, younger population, and steadily increasing and generally high case numbers, which, like Derek said, are also reflected in higher acute hospitalizations. Even now, although our case numbers are going down, we still have fairly high hospitalizations, and some of them are recent due to actually people in all age groups getting exposed to COVID who are eligible for vaccination but unvaccinated and requiring hospital care and ICU care. So I think that Gamma we're watching closely, and Delta again at 67, predominantly in the large urban centers. Most of the initial cases were related to international and interprovincial travel. It hasn't taken off quite like Alpha did. Part of it is, again, case contact investigations will remain critical. If you're symptomatic, get tested, comply with public health measures. As the Premier said, because all these variants and even the Delta variant responds well to 2 doses of vaccine, if you are 2 weeks after your second dose, you may not require to isolate unless there are specific circumstances. And I think that is really important. But on the other hand, for all other exposures to the Delta variant, you will require to be isolated. And that is going to be critical to keep COVID in general and variants in particular at bay. But of course, even as a fully vaccinated individual, if you get symptomatic at any time, even as a close contact or otherwise, we still expect everyone to stay home and seek testing, because that is going to be a critical tool, even as public health measures, as we proceed into step 3, even as many of the restrictions around gatherings and other measures, stand down. These simple principles of testing and contact tracing will still remain in place. And finally, we always said that, May, June are going to be blockbuster months for vaccine supply. Now, even those estimates are going to be exceeded by high volumes of Pfizer and Moderna vaccines coming. And again, as Derek laid out, lots of opportunities to get vaccinated. And I think we really owe it to ourselves to have a great summer and a great fall, to really roll up our arms, get our first dose, and then get our second dose. Thank you.
Follow up, Arthur?
I think this is the first time that we've had you since we had like the full date and the full details for the CFL season coming. And I was wondering, when you first talked about filling up Mosaic Stadium, there was still not a lot of clarity there. We weren't sure whether it was going to be gradual, whether we were going to be able to have it done all at once. Can you give a sense, as you envision the lifting of all public health restrictions for the phase 3.5, let's call it, what you think the CFL season will actually look like at the stadium?
Well, it'll look exactly what Saskatchewan people want it to look like. Obviously, there will be no restrictions on the number of people that will be able to attend. In saying that, there may be people that are possibly hesitant to go into a stadium with 25, 30, or 33,000 people in there. Many people will be fully vaccinated by the first week in August when that occurs, and we again would encourage anyone that hasn't started that process to get out and start it now. If you went out and got your first shot today, you would be eligible for your second shot prior to the CFL season opening. That may be an incentive for some to get started on this sequence of shots sooner rather than later. When we first were talking about, and Dr. Shahab, you might have a little to add to this, first talking about, first of all, the rules for safe play for the CFL. For the CFL players, which was step 1 of the process. Step 2 of the process was then, whether we would even be able to have any degree of fans that would be, allowed in an open air stadium such as this, and then to what degree you could have those number of fans in the stadium. So now there will be no limits on that. They potentially could, and I actually personally think they likely will be able to fill the stadium here in Regina. I'm going to go to the opening game if my schedule allows, which I hope it does. And cheer on the greatest football team in this country and likely in the world. And as they embark on the season to return the Grey Cup back to its rightful home here in Regina. It's been in Winnipeg far too long, for an extended period of time, which is really a travesty. So as we lead into this season, I think it's just very important for us to realize, a few things. First thing is vaccines do work. And if we do believe that vaccines do work, then we do have to have faith in the fact that we are going to be able to move through and do some of the things that we used to take for granted. And coming together in large groups, coming together to meet with family and friends, whether that be at a conference, whether it be at a Rough Rider game, whether it be at a family reunion, coming back together in our workplaces rather than virtual. I was on a Western Premiers call this morning, which was virtual, and we had all agreed that we look forward to next year's Western Premiers conference, which will be in this province, that it will not be virtual, and that will be in a large part thank you to the vaccine effort that we have have here in Canada and ultimately by that time around the world. That being said, as we go to our first CFL game, and like I said, I hope to be there in the stands with however many else choose to be, and I think it'll be many. I think, in fairness, things will be somewhat different as well. It'll be the same, but somewhat different. I'm certain that there will be some people that will be wearing masks, although it won't be required, and that should be normalized, I think, by this period of time. I will have a mask with me, and if there's a point in time where I might just feel uncomfortable in a close crowd, you may see me put my mask on. You may not. I won't speak for what that looks like almost 2 months out from today. But I think you'll see traffic flows somewhat different. I think you'll still continue to see the access to things like Isogel, soap and whatnot, and soap and water, obviously. But I think you'll see things, return to normal. But whether they will ever be exactly the same as they were 2 years ago, I'm not sure. I think you'll see some differences, in particular, in those areas where there's a large number of people. What we see at a Rider game, what we see at universities where we have many thousands of students coming together, even what we see in many of our schools, in particular our larger schools where we have 500 to 1,000 plus kids, students there. That environment has changed, and I expect some of those changes will be extended at least for the foreseeable future, maybe not forever, but for some period of time. This last year year and a half has changed a lot of things in our nation and around the world, and Rider Games is just but a part of that. Dr. Shahab, you have anything to add with respect to kind of the process on getting to where we got to for the potentially a July 11th step 3 of the reopening, or 3.5?
Yeah, thanks, Premier. So, I think the last 15 months was managing a pandemic, and the last 6 months, especially the last 3 months, have been, getting vaccinated. And now, as we move forward, especially after step 3, we all need to learn how to live with COVID. The COVID will be a pandemic in many parts of the world, unfortunately, for the next several months, but thankfully, we can look forward to a time in the near future where it will be an endemic illness, which means that it will be around in low numbers in Saskatchewan and likely most parts of Canada. And then how do we live with that? And so what we are already seeing with our improving vaccination numbers and despite variants is that when we analyze outbreaks in May and June, we see that for the most part, transmission happens in people who are unvaccinated or have had only one dose and less than 3 weeks ago, and we showed some data related to that last week. We'll continue to bring that data every month, just to reassure ourselves that vaccines are working. As we've started having, small indoor gatherings, and now with step 2, larger outdoor gatherings, both public and private, we'll continue to monitor that. And obviously, we need to support people who would like to wear a mask even at a gathering, even if they're fully vaccinated. If you aren't yet fully vaccinated, maintaining some in step 2, some physical distancing, mask use in indoor places as we get fully vaccinated. But ultimately, what we are seeing both in Saskatchewan and from other jurisdictions is once you have low case numbers, once you have a high vaccination rate, 1 dose, then 2 doses, you do reduce the risk of large super spreader events. But having said that, I must concede that that risk will always be there in pockets where people are unvaccinated. And I think that's why exactly we need to really continue to work to bring up our first dose and then second dose in every age group. I think while serious illness is more common in people who are older, we have had hospitalizations and deaths in every age group. And it is really important to bring our vaccination rates up in everyone 12 and older. And that also indirectly protects children 11 and younger. It indirectly protects those who are older, but maybe immune suppressed and not fully protected by their own vaccine, and also allows us to safely have larger gatherings without the risk of super spreader events. And this is, again, something we'll be watching closely and providing information to the public as this progresses. Thank you.
Very fortunate here, just about to add to that just a little bit as well. We do have lower numbers, as Dr. Shahab said. We have lower hospitalizations, as Dr. Shahab had said. The variants of concern have changed things to some degree. We do see those that are sick and those that are in hospital are younger than they were a number of months ago, but thankfully our overall numbers are lower in general, both as with respect to positive cases and with respect to hospitalizations. And that is in a large part due to the fact that we have hundreds of thousands of people that have their first shot and are now coming back for their second shot. If you remember, and this data might be a week old, Dr. Shahab, but I had said earlier we have 92% of new cases are people that have not received a vaccine. 82% of our hospitalizations are cases of people that have not received a vaccine. So as we move forward, and Dr. Shahab had said, we do now need to transition to learning how we are going to live with COVID. And that's going to be different. I'd always said previously that we need to get vaccinated to not only keep ourselves safe, but to keep those around us safe. That's still true to a degree. But now as we learn to live with COVID, I think it's fair to say you need to consider getting vaccinated to keep yourself safe. Those over 9 out of 10 people that do get COVID in the months and days and months ahead will be people that have chosen not to be vaccinated. Over 9 out of 10. Over 80 out of 10 people that are in our hospitals are people that have not been vaccinated. So, as we move forward, those people that get COVID are, if you're not vaccinated, are you going to get COVID? Likely, at some point in time, as we live with it. Are you going to get sick? Not sure. You may not, but if you're vaccinated, you very likely aren't going to get sick. But over 9 out of 10 people do get COVID, are unvaccinated, and ultimately some of them are going to get sick. Will it be you? I don't know, and nor do you until it occurs. And then ultimately, if you do get COVID and you do get ill, we require hospitalization. If you're vaccinated, your chances of being hospitalized, of even getting COVID or being hospitalized, as Derek had said, are exponentially lower. Ultimately, as we say, over 8 out of 10 people that are in our hospitals are people that are not vaccinated. So as we move forward and learn to live with COVID, as Dr. Shahab says, I think it's important for us to realize that the decision now to get vaccinated is not just about keeping those around you safe. Those around you likely are vaccinated. The decision now is about keeping yourself safe.
Go to our next question in the room, Murray.
I think these answers are confusing to Saskatchewan people, so can we cut to the chase a bit? And I guess the question for Dr. Shahab is, if we have large gatherings like Rider Games, are they going to be safe? Are you going to recommend them as safe, particularly with the Delta and Gamma spread, and particularly with the fact that in those crowds, likely 3/4 of the people won't have second doses and a substantial number won't have first doses. So can you tell us unequivocally whether you're going to recommend whether large crowded Rider Games are going to be something that can be safely done?
Thanks. So what I am stating is that we already have expanded the gathering sizes significantly in step 2. In step 3 and beyond, there will be no limits. And that's exactly the point that I think I was trying to make earlier, that going forwards, obviously we can't stay in a pandemic forever. We are reaching a point where with our high vaccination rates, low case numbers, we have to, initially in the summer with outdoor events, start having gatherings in a way that for vaccinated people, it's going to be extremely safe. For unvaccinated people who should really wear a mask if they choose to attend such an event, but there'll be no way to monitor that. It may be safer, but not as safe as if you're fully vaccinated and 2 weeks out from your second dose. And that's the approach that will have to be taken. Once public health orders and restrictions end, it will be up to each individual to assess the risk to themselves and their family as they engage in these events. And again, I would like to reiterate that, as an endemic vaccine preventable disease, the safety to yourself and your immediate family will be determined to a large extent by your vaccination status, whatever the setting is. And we focus on large gatherings outdoors. They are very dramatic, but the fact of the matter is the bulk of our transmission always throughout the last 16 months has been in small indoor gatherings, those meetings between friends and family, which now we can meet after many months, up to 10 people, and now in step 2, it'll go up to 15 people indoors. So we're being very cautious there as well. But even there, if you're unvaccinated, the risk of transmission within even those small intimate gatherings is high as well. And whether you have 10,000 people in one place or 1,000 gatherings of 10, the risk really is the same. It's just that in a large gathering, you can have a more dramatic super spreading event. But I think in everything we do, meeting friends and family outdoors, which is much safer over the summer, learning how we do that to get ready for the fall, meeting friends and family indoors, maybe reassuring everyone that everyone's fully vaccinated. I think those are things that we all have to become comfortable with. And there will remain always a risk of COVID, more so if you are unvaccinated. And obviously, we can't forecast the future, and we'll always have to keep monitoring through testing, through whole genome sequencing, if there are in future other variants of concern that require special attention and specific measures. Thank you.
Follow-up, Murray?
Mr. Premier, given what Dr. Shahab just said, if I interpreted properly, would it not be your responsibility as Premier to have more definitive rules? You basically said earlier it's up to the people in terms of the rider games, in terms of behavior. But given what I just heard from Dr. Shahab, it would seem to me that the stronger suggestion is that there should be definitive rules related to whether you can be vaccinated to go to the game, or whether you wear masks, or even how many people can go to a game at any given time. Now, those would all be things that you would have to establish. So do you not see that as your responsibility in relation to this third term, given some of the things that Dr. Shahab is saying about the legitimate concern? Obviously, we have to get out of COVID at some point, but in terms of the early games, we have 4 home games, and I think in August, if I remember right. Given those concerns early on, shouldn't you be offering more definitive rules as a provincial government in terms of what is and isn't acceptable at such large gatherings?
A couple of things with that, Murray. First of all, we don't get out of COVID. I think what we need to look at is how we live with COVID. I don't think we're going to get out of it. We're going to learn how to live with COVID. And by far and away, the tool that we have that is most effective for protecting us as we do live with COVID is to receive your full sequence of vaccinations. Your first shot, wait your allocated time period, and then receive your second shot. This is the best protection that you can offer, not only yourself, but in particular yourself, but also those around you. Vaccines most certainly do work. They've proven to reduce not only the incidence of COVID by exponentially, as Derek had said, but also reduce the sickness and ultimately hospitalizations of COVID. So it's the responsibility of the government to do everything that we can to ensure that the vaccines that we receive from the federal government are being made available to as many Saskatchewan people in as timely a manner as possible. We have been doing that for a number of months now. We're continuing to do that, as you see the list of the number of efforts that we're making to increase our first dose percentage as per the first question, but also making large numbers of vaccines available for second doses as well. You had mentioned in the question there'd be a substantial portion of folks that wouldn't have their second dose by the first week of August. There'll be a substantial portion that do. We're 21% today and climbing each and every day by thousands of people. Will everyone in the stadium be vaccinated? Likely not. Will everyone in the stadium have one shot? Most will. And will everyone in the stadium have 2 shots? Many will as well. We see what's happening south of the border in enclosed stadiums at hockey arenas and such. And we most certainly have made every effort to to provide vaccines to Saskatchewan people so that they can make the choice on receiving a vaccine to keep themselves safe. And most certainly, as I had said at the outset, this is one of the wins. This is one of the wins of if enough of us get vaccinated, preferably if all of us do, is we get to go back to doing things in our community that at one point in time, quite frankly, we took for granted, and I don't think we'll take them for granted for a long period of time now.
We'll take our next question from the room, Mark.
This kind of follows up on what Arthur talked about earlier, is would the province consider delaying our reopen until more people can get the second shot to protect against the Delta variant?
We're going to have the second shot open to 45 in the next couple of days. I believe it's open to 12 and over in the next very short period of time. And what we're seeing in other areas of the world, and Dr. Shahab, you'd likely most certainly add to this. Maybe Scott or Derek would like to add as well as to precisely what our second dose strategy is and continues to be. But in a very short period of time, and I think I had mentioned this in my opening comments as well, the first 100,000 doses took us 3 months. We've done, I think, about 700,000 doses since then. Most certainly now we're doing well in excess of 10,000 doses most days of the week, close to 20 on some days of the week. So it isn't going to take all that long for us to get through the second dose strategy, to the point in the news release I think we had mentioned that people should make sure that they have the time interval between their first and second dose so that they're not getting the second dose a little too quickly, which really speaks to the difference of where we were just a few weeks ago in our access to vaccines. So it's our full intent to make the second doses available to as many, if not all, Saskatchewan residents through the months of June and July. And then ultimately, as Dr. Shahab always says, once you're eligible for your first or second dose, you're always eligible for your first or second dose. And I would expect that we'll see, a number of people coming in over the course of the month or two after that, receiving both of those doses. And I think Derek in his slide had said by the end of summer, we hope to be well in excess of 70% with both doses, but ultimately up to 80% as well. Scott or Derek, do you have anything to add, or Dr. Shahab to that?
Well, Premier, just quickly, I do have a couple of points. One is, as we've said many, many times, the rate limiting step to vaccine delivery has not been our capacity to deliver vaccine, but rather the supply. And that problem has been recently solved. And I just point out, if we talk about second doses, let's talk about Moderna. 2 weeks ago, we didn't know what was happening with Moderna. Next week, there'll be enough Moderna arriving in a single shipment to give all second doses to anybody who's received a first dose of Moderna. So with respect to the second dose strategy, it's never wavered. We continue to offer as many clinics as possible to those requiring second doses. With pharmacies on board, we continue to deliver, we'll be delivering over 160,000 vaccines per week. And we continue to grow and expand and use as many mechanisms as we can to deliver those vaccines. I don't know if Derek, if you had anything else you wanted to add?
I don't think so, Scott. Thank you.
I'll just maybe add a couple of points which are also part of the announcement today, is that as we live with COVID, and live with a vaccine preventable disease, we will obviously have to respond to local outbreaks or clusters or increase in cases if they were to happen. And that will be like many other vaccine preventable diseases. We've always dealt with outbreaks of measles, mumps, pertussis in a very coordinated way, working with our healthcare partners, schools, other partners, where, if you are unvaccinated, unfortunately, you are excluded from school or other settings until such time that the outbreak is over. And so, the fact that as a fully vaccinated individual, you don't have to isolate as a close contact, but you do have to, even if you have one dose, I think is all working towards that, where when we have an outbreak or an increase in transmission, we will have to take steps, as we do with other vaccine preventable diseases, that may mean some restrictions on people who are unvaccinated and at risk of exposure or have been exposed. And over time, we'll have to modulate these responses, because the evidence is suggesting that as we get back to normal operations, people who are fully vaccinated are at low risk of either getting symptomatic or becoming seriously ill. So again, there will still be a need to monitor case numbers and respond as we do with many other infectious diseases. Thank you.
Follow up, Mark?
This is for Scott or Derek. What's kind of the logistics that are going to go into this first dose surge, and how big of an undertaking is this going to be to roll this out in a number of different locations?
So I'll let Derek take that question, Mark, but I would just say the process of identifying and prioritizing first doses has already started. And it will continue to expand throughout the week with, as Derek's presentation outlined, a number of examples of what's happening, but Derek can certainly expand on that. Go ahead, Derek.
Yeah, thank you, Scott. So our teams have pivoted just over the last week in order to provide this surge, focusing on first dose uptake. As part of that, they've looked at the data in their neighborhoods, in their areas that they're responsible for, and really thought about what are the opportunities that are out there that could really target those that where we see a low uptake and achieve a good turnout for the first dose clinic. So they looked at the data and then they also looked at our current operations as well as where can we pull people from and resources from in order to set up in various locations. There's also been a lot of work with different organizations in order to bring the vaccine onto different property owners, be it at malls or in parking lots, in parks, whatever it might be. We've been working to get those set up in order to really put a strong show out this week and try to generate some interest and enthusiasm in getting out those that haven't got their first dose yet.
We'll take our next question from the room. Adam?
Just to Derek or Scott, you just talked about the data showing you where first doses may be lacking. What can you tell us about where people have been missed and maybe some of the biggest reasons why people haven't got a first dose yet based on the SHA's feedback or what you're understanding when you designed this plan?
Derek, do you want to speak to the data the teams looked at, and then we can add a little bit after?
Yeah, certainly, Scott. So we have detailed breakdowns of what the uptake is in different neighborhoods, as well our local teams who provide public health services. They are very familiar with through the various partnerships that they have with organizations and communities to really have a good understanding on the ground of what might be some of the barriers and obstacles for people to get out to get the vaccine. And so we are targeting efforts, for example, in core neighborhoods to bring it to those communities that might have lower uptake. The other one that our strategy really focuses on is the youth. We know that we have a lower uptake if you're under 40 than if you're over, and that has really driven a lot of the decisions about access, about taking it to where people live, work, and play, to provide easy, convenient access to those age groups that so far we haven't achieved those higher levels of first dose uptake. So that's some of the thinking that's gone into the plan as we've put it together.
You have a follow-up, Adam?
Premier, you mentioned this a little bit at the start. Are you ruling out incentives at all? I mean, Manitoba and Alberta both have a higher percentage of people dosed for the first dose. And if we keep on this trend, we'll be the lowest among the provinces in Canada for most likely a second dose as well, even though we're ahead right now. So are incentives off the table or just for right now?
No, they're not under consideration at this point in time. And we're very close with where Alberta is and not really that far behind Manitoba as well, and ahead of about the same as Alberta on our second dose strategy. And so we have had a shift in this province where many of the doses that we've been providing each and every day are second doses. We have a little bit of a focus back in on our first dose strategy here to address, if you think back to I think Dr. Shahab had said the 3 C's of vaccine confidence, vaccine complacency, and the convenience of receiving your vaccine. And you look at the demographic that has a lower uptake in the 40 and under, maybe even 50 and under, but 40 and under. The SHA has said that the confidence piece. Confidence in the vaccine is not the largest issue. For the most part, it is the convenience and the ability for young folks to make time in their schedule, very busy schedules as young parents and with busy careers, to make time in their schedules to find time to go out and ultimately schedule a vaccine and go out and get that vaccine. We had tried to make efforts to make that easier with the 3 hours of paid leave that we had earlier in this campaign, and now we're trying to take even an additional step with these number of pop-up clinics that will be popping up in communities and in organizations across Saskatchewan to really try to reduce the hindrance or make it more convenient for our young folks here in the province to ultimately receive their vaccine. If there's one thing that changes today, for me, there's a number. I spoke about this in my opening comments as well. But there's a number of real benefits to going out and getting not only your first dose, but getting your first dose right away, and ultimately your second dose. Obviously, your risk of contracting COVID is far less, exponentially less. Your risk then of, even if you do contract COVID, which is already lower, of getting sick and being symptomatic from the virus is again far less. And ultimately your risk of being in hospital if you have both of your vaccines versus if you have no vaccines, again, is far, far less, which ultimately means at the end of the day that your risk of the ultimate consequence of COVID, of death, is much, much lower, exponentially lower if you are vaccinated with 2 shots than if you have had none. If none of that is enough incentive for you to make some time in your week to go get vaccinated, if you have been required to self-isolate, and I know many of our youth that I know in the communities that I represent and in the community where I live, nieces and nephews have been required to self-isolate. If you're fully vaccinated, and plus a couple of weeks, that requirement, if you come into contact with someone with COVID, is no longer there. You will then not have to self-isolate for those 2 weeks. I myself self-isolated with my wife for a week or 10 days, and it'd be my hope that I don't have to do that again. It's a long time to not be, carrying on with your career, carrying on with, seeing the people that you want to see. So if COVID doesn't frighten you, if becoming sick, hospitalized, or you don't think that the virus ultimately has the ability to really have an impact on your health, being in contact with someone that has COVID does have the ability to have an impact on your daily life in requiring you to self-isolate. That all goes away with 2 shots. And so if, today may be, I think, a real motivation for many in Saskatchewan to reconsider making time in their very busy schedules, and I understand they're very busy, but making time to go out and start that sequence, get your first shot this week, get your second shot in whenever you are eligible and you've had enough days between them. And ultimately, if you start today, that will get you your second shot in time to attend the home opener Rider game.
And we'll take our last question from the phone line.
We have Lara Famanoff with 650 CKM.
Hi, thank you so much for taking my question. Earlier, Premier Moe, you mentioned that people who have been fully vaccinated against COVID would not have to quarantine or self-isolate should they be considered a close contact of somebody who comes down with COVID. But anyone can say they're fully vaccinated. So could you please explain how exactly that is going to work when public health calls and asks and tells you that you're a close contact? Will you have to present your healthcare number, or will you have a vaccination card, or how's that going to work?
Scott, you might have a comment on that, or possibly Dr. Shahab.
Yeah.
Go ahead, Dr. Shahab.
Yeah, this is just like any other vaccine preventable disease that public health has that information, obviously, and will discuss with you. And, and if there's specific reasons, for example, if you're a healthcare worker or you yourself are fully vaccinated, immune compromised, or there are other considerations, that discussion will also happen. So, there's a clinical aspect, there's a public health aspect, but that information is available, to public health. But obviously, throughout the pandemic, it's been up to all of us to do the right thing, and physically distance, wearing a mask, now getting vaccinated, and that has been the cornerstone of how we have gone through this pandemic. And I think we have to treat all of these measures with the understanding that people have done for the most part and will continue to do the right thing, which also includes, as we enjoy the summer, but increasingly in the fall get into cough and cold season, staying home if you're sick with a cough or cold and getting tested. We have had virtually no influenza last year, very little coughs and colds. Now that public health measures are going to be removed, mid-July onwards, we expect to see, the usual coughs and colds making the rounds, including influenza. So all of that will have to factor into living with COVID. We have to live with other respiratory illnesses. And part of that would now be, we always say, if you're sick, stay home till you're better. But now we say, if you're sick, stay home and get tested for COVID to make sure that you're not, irrespective of your vaccination status, to make sure that you are not inadvertently transmitting it to others. And that will be the cornerstone. Thank you.
Follow up, Laura?
Yes, I'm sorry, perhaps Dr. Shahab, I missed it. So are we saying we're going on good faith here, or how will someone provide proof that they have been fully vaccinated and they don't have to quarantine?
You might be able to speak to that, or Dr. Shahab, either one.
Yeah, Scott can add, but generally when public health does an investigation on any vaccine-preventable disease, that information is available to public health, and then the discussion happens with the family. Of course, sometimes someone may have traveled and may have been vaccinated in another province, but generally that has not been a problem. And again, I think that's how it's worked for COVID, for other vaccine-preventable diseases. But generally, when public health engages with the family, it's not an issue of people providing incomplete information. It's an issue of managing it as per the protocol, which now going forward will be that if you're fully vaccinated, you don't have to isolate. Scott and Derek, if you may want to add some further comments.
The only thing, and I think you've already addressed it, Dr. Shah, but I'll just be crystal clear, is that there is a provincial computer system called Panorama, which everyone who's been vaccinated has a record of how many doses, what vaccine they received. And it's what our public health resources use both to contact, trace, and follow up, but it's also what our vaccination teams do to ensure that when somebody comes for their second dose, that they're getting the right drug. Now, we can mix and match now, but that system is used province-wide and has been since the inception of the system, which predates COVID for many, many years. The other thing to remember mind is everybody who has My Sask Health record would also be able to identify for any individual that they've received 1 or 2 doses of the vaccine, because they would have an electronic health record they can carry with them anywhere in the world that would actually show how many doses of vaccine and what vaccine they received and when.
Thanks very much, and that concludes our time for today.